Hello people, in this video let us look at the symptoms and signs of pregnancy in first trimester. So subjectively you have the amenorrhea, that is missed period, morning sickness, frequency of micturition, then breast discomfort and fatigue. Most of these are very unspecific, they're not so specific, and these are subjective. Now coming to the objective symptoms, you have breast changes like Montgomery tubercles, the secondary areola that comes, the increase in breast size, etc. Per abdomen, what will happen? The abdomen, guys, we're going from up to down, so you can understand after the breast abdomen, the uterus will become an abdominal organ after 12 weeks. Then coming to the pelvis, guys, first of all the uterus, then we'll go down to the cervix and vagina. Uterus, what will happen to its shapes, size, shape and consistency? The uterus will enlarge, obviously, right, and it will become globular. And it will become soft and elastic, obviously, because this uterus will have to house this baby, isn't it? So it will become large, globular, soft and elastic. Then you have the Hagar sign. What is Hagar sign? So basically the fingers, they oppose at around 6 to 8 weeks starting. You know what will happen? When you put the hand into the vagina, into the anterior fornix from the side, and the other side, two fingers if you put, and if you compress on the lower part of the body of the uterus, you can feel the fingers opposing. Okay, don't compress or squeeze. Basically you should be very delicate while you are doing this test, as it can cause an abortion. This is Hagar sign. They can ask this in the exam. Then coming to Palmer sign, guys, that is nothing but rhythmic uterine contractions. You can observe them as early as 4 weeks. Okay, 4 to 8 weeks. So here they are showing you the contraction and relaxation. So all that is about the uterus, guys. Now let's move on to the cervix. Cervix, you can see that there is Goodell sign, good news kind of a thing. Basically, the cervix will be soft like lips, okay, at 6 weeks. This is a Goodell sign. That is why you should remember, when you're handling the cervix of a pregnant female, you should handle very gently because it will be soft, okay. You should use blunt instruments. Then coming to vagina, what are the signs in vagina? So you have the Jacquemer or the Chadwick sign, then you have the Osiander sign. Jacquemer or Chadwick sign is basically we have put it in blue because it is the anterior vaginal wall becomes blue, right? Something like this they have shown, that is due to vascular congestion. So it will become blue. This is Jacquemer or Chadwick sign. So again, this is when at 8th week of pregnancy. Okay. Blue, you can remember. Then coming here, then you have the Osiander sign. Osiander sign is also at 8 weeks only. Basically, that's set of the vagina. So what will you see here in Osiander sign? Vagina, what will happen? This is more of a feeling kind of a thing. You can feel increased pulsation felt through the lateral fornices. So to know that the pulsation has increased, you should know how it will be before, isn't it? So this is Osiander sign. One more thing about the vagina is there can be mucoid discharge, okay, which is not under Osiander sign actually. Osiander sign is only about this increased pulsation, okay. Let's go back here. So we were looking at the signs and symptoms of pregnancy in first trimester. We have finished the subjective ones and then the objective, this part of it. Now let's continue with the objective. These are more like lab investigations kind of a thing. You are doing test for beta hCG, that is immunological test for diagnosis of pregnancy. You have without radioisotopes. This is what you are going to do in your urine pregnancy test, isn't it? So basically your urine pregnancy test will have the antibody to hCG. Okay, what does it have? It has the antibody to hCG. Okay, and when you put a sample of urine, where is the well here? So you'll put a sample of urine here, and once it reaches here, basically if this hCG is there in the urine, then this antibody of hCG will react with the hCG and it will give a positive line for you, right? So this is what is the immunological test, that is antibody antigen reaction. The antigen here will be hCG and the antibody will be in the to the hCG will be in this card. Remember, you will have a control line which has to appear, okay, and the test line will appear only if the person is positive. This will be the sample well where you can put the urine. So you have ELISA, agglutination inhibition test, you have direct agglutination test, okay, and then you have with radioisotopes. Looks like if the person is pregnant, then they in this test actually there will be no agglutination, no visible agglutination, then only you will get the line. So it's kind of opposite, okay, remember that. So this is all about the test. So remember, the commercially available antibody to beta hCG is used, and the antigen hCG will be present in the urine or in the serum, okay, that is the blood. Look at this. So you have all these tests: agglutination inhibition test, direct latex agglutination test, sandwich ELISA, etc. Then you have ELISA, and then you have the radio. Here you can see radioimmunoassay. Also you have. Apparently with radioisotopes, if you do the test now, it is very sensitive. The radioisotopes, if you use, it is very sensitive. It can detect very low beta subunit of hCG also. Okay. The levels of beta hCG will be like very low, almost undetectable in non-pregnant, and then when they get pregnant, it doubles every 2 days, and then it reaches around 100 international units, and then it's kind of constant or falling, and then it peaks at 32 weeks. So you can guess the gestational age also by measuring beta hCG levels. This is a beta hCG non-pregnant level. You can see how it is. Lastly, let's talk about ultrasonography. This is also very confirmatory. Basically, you can see the gestational ring that they are showing here, right? So this is at 5th week. So ultrasound will tell you a lot. You can also detect the cardiac activity, isn't it? That's all about ultrasound. So basically in this video, you have looked at all the signs and symptoms of pregnancy in first trimester, because first trimester only they want you to be able to detect the pregnancy. Otherwise, second trimester and third trimester could be really easy. First trimester, you have to catch it early, isn't it? So what are the things that you have seen? Subject of like amenorrhea, missed period, morning sickness, very subjective due to increased beta hCG, frequency of micturition, again because of some osmoregulation, isn't it? Breast discomfort can be there, increasing size of the breast, fatigue. Then coming to breast changes, we told you about the Montgomery tubercles, secondary areola, increased breast size, erect nipple, etc. Per abdomen, the uterus becomes abdominal organ after 12 weeks. Then pelvic changes, uterus, we told you that the shape it will become big, it will become globular, soft and elastic. Hagar sign, basically the fingers will oppose. Palmar sign, uterine contractions are rhythmic even from 4 weeks. Cervix, Goodell sign, soft like lips. Vagina, Jacquemus sign or Chadwick sign, that is the anterior vaginal wall is blue. Osiander sign is basically to say that increased pulsations can be felt. Okay. The lateral fornix, they said I felt. Okay. Then immunological test for diagnosis of pregnancy, that is the beta hCG levels you will check. Antigen antibody reaction. Ultrasonography, we said gestational ring you can see, fetal heart, cardiac activity you can make out. Okay, that's it about the signs and symptoms of pregnancy in first trimester. That's it for now, guys. Bye bye.